Welcome back, everyone. I feel like I'm missing you all. I feel like there's something in my life and I'm searching for it. So it's nice to see everybody's face. Welcome to our bi-monthly meetings for the governing board. Zoom, we're back on Zoom still. The Zoom etiquette we all know very well, trying to keep our cameras up as long as we can if our bandwidth allows. You can use the chat and please do. I want everyone who may be a guest or staff, if you would like to put your name and organization or position in the chat so that we all know and we can keep track in the minutes of who attended. The board members, I will be doing a roll call. First, I wanted to acknowledge that we are on the traditional lands of the Confederated Tribes of the Colville Reservation. That is 12 individual tribes within one consolidated space. And we honor with gratitude the land itself and those people who are still here. They're great partners of ours, and we want to bring to light their heritage. Thank you all for acknowledging the Colville tribe. I'll start with the roll call now. Harleen Anders, would you just say here if you're here? Thank you. Oh, this one has Kathy on it. Deb Murphy?
So it'll be Linda.
And then who was that?
Linda McKay.
Okay, thank you. Get that changed. Dell Anderson. Manuel Navarro.
Present.
There you are. Thank you. Ken Sterner.
I'm here.
Okay. Ramona Hicks. Haven't heard from her today. Okay. I know that she had hurt herself, so that could be what she's out. Ray Eichmeyer.
And Ray will be out today.
Okay, thank you. Linda McKay. There you are. Rosalinda Kibbe.
I'm here.
Oh, there she is. There she is. Okay. Senator Warnick. Probably pretty busy right now. Dr. Tuggy.
Yes, I'm here. Having some bandwidth issues.
I understand. Ours was acting up earlier today, so. Maddie Osborne.
Good afternoon, I'm here.
Thank you. Teresa Atkinson. I see you.
Hi there, I'm here. I'm going to be in travel status partway through the meeting.
Okay, thank you. Nancy Spurgeon. I'm looking in all my names. And Peter Morgan.
I'm here.
Thank you, Peter. Okay, we've done the roll call, and if John can pull up the agenda, or who the person is who's doing that piece. If you've all had a chance to review the agenda and the attachments, if you feel like there could be a conflict of interest, please say something at this time. Also, during the meeting, if something comes up that concerns you, also, again, please let us know and we can get that declaration of conflict into the minutes. So it's super important. We also have visitors here at this time. Do I have any public comment from any of our guests?
Oh, just thank you for having me.
Thank you. Thank you. Yes. I'll have another chance then at the end of the meeting when I do a round table and adjournment. So you do have time to think of if you have any announcements. And then the final piece, yes? Is the approval of the consent agenda. So pages 1 through 12 of your board packet includes an agenda and acronyms. The consent agenda is the minutes from the December meeting and the monthly financial report. So at this time, I would like to open the floor for a motion to approve the consent agenda.
I'll move to approve the consent agenda. This is Carlene.
Thank you. Thank you, Carly. Do I have a second on that?
Second.
Any questions? Give you all still a moment. Hearing no questions, we have a motion and second. All those in favor say aye for approval of the consent agenda.
Aye.
Aye.
Any opposed? We have in the minutes those absent, so that will be reflected and motion carried. Thank you all. Now it's time for the executive director report. So I bring on John Chapman. Please, John.
Thanks, Molly. And perfect, you got it up. Thank you, Morgan. Morgan will be navigating us through the day today. And I appreciate her doing that for us. So welcome and Happy New Year, everyone. I know it feels weird that it's been since 2020, since we've all been together. It hasn't been that long, but long enough. So I'm gonna give you some brief updates. A lot of today is really to get us up to speed and centered on this work moving forward. And then we also have a great chance to share some of the branding work and partnerships that we have been doing. So similar to a lot of my ED updates, we're going to start statewide and then boil it down to some direct operation work. And the statewide updates are primarily to ensure that you guys are informed of what's happening with our partners across the ACHs and with the Healthcare Authority, Department of Health, and anyone else we work with. So as you all know, one of the primary things we do across the 9 accountable communities of health and the Healthcare Authority is working out the details of the 1115 waiver renewal that is hopefully going to be finalized by July of this year. What I can tell you is since December that the Healthcare Authority is actively engaging in negotiations with the Centers for Medicaid and Medicare Services, specific for accountable communities of health and directly related to our ACH is a section of the waiver called the TALK budget, which is taking action for healthier communities, because we all love acronyms, and anything that has an H in it, we need to include in any of the work that we do. So they have entered contract negotiations with CMS. There's 2 primary components associated with the ACH on that, which includes looking at what they are calling community hubs, or really focus around community-based care coordination, as well as health equity funds. I wish I had a lot of detail to tell you about the negotiations, but what I really can say is that they are in the initial stages and they are working out some of those high-level details. We haven't received or been told by the Healthcare Authority that the timeline has changed, and so the expectation would that the July 1st timeline is still on track moving forward. My hope would be is as we get closer to that timeline, or as we get into July, we'll be able to spend some more focal time with the governing board, going over the details of the waiver and getting additional feedback. At this point, a lot of it is still really early on in the process and really early on in discussions. One of the things that is going on currently is the managed care organizations, the Healthcare Authority, and ACH representatives do meet on a routine basis. We took 2 months off over the holidays and ramped back up. And we are meeting to iron out and continue some discussions around community-based care coordination, community hubs, and that section of the waiver work that also includes working in partnership with managed care organizations around how they're going to be delivering in lieu of services or health-related social needs. That again, still in the early stages, and when I have an opportunity to bring more details back to everyone at this board, I will continue to do that. The other new update, again, with a little bit more information that is going to need to come at further meetings, is the Healthcare Authority is looking at infusing how they would do community information in the 1115 waiver. You may or may not be familiar. I can't remember if we had shared the report, but the Washington State Healthcare Authority last fall worked in conjunction with a consultant called McKinsey to do a community information exchange landscape. They also shared this and did this in conjunction with the Health and Human Services Coalition, which includes 5 state agencies that are looking at how they better partner together across the state. And within that report, they were going to do a ask within this coming budget for a CIE proposal that did not make the governor's budget, and my understanding at that current juncture and the recommendation was to move it into the waiver instead. I think that needs to be ironed out in a little bit more detail, but I wanted to give you guys a heads up, just because if it gets filtered into the waiver, it also means that there would be a more direct link with how they partner with ACHs in that work. Staying on that track, just some quick legislative updates. One thing I wanted to give you guys a heads up on, you will see in your packet a one-pager that gives some legislative priorities focused on Medicaid Transformation Project. That one-pager was really created with the Accountable Communities of Health lobbyist, Melanie Smith, who is working with 9 ACH Association in really engaging the legislature this year in supporting the Medicaid Transformation Project waiver and encouraging the continuation of this waiver renewal in the B&O tax exemption that ACHs got in the initial waiver, as well as really just doing a lot of education and advocacy about what it means to be an accountable community of health in the state of Washington and how we are trying to move this work forward collectively as the 9 of us across the state of Washington. So in regards to the statewide work with the 9 ACHs, it's really still focused on the waiver renewal and our engagement in that. There are some ties to community-based care coordination and community information exchange, since that work is the waiver renewal, as well as just really advocacy and education at this point in time. Locally, I would share 2 key bills, or a few key bills that we're also paying attention to. There's both a bill in the House and the Senate for a behavioral health support specialist, and this would help move forward the process of credentialing and licensing a BA level behavioral health support specialist. I really am just going to be transparent to say I've been tracking it, but Wendy Bresney, who is our Director of Clinical Integration, has been tracking it better than I. And so if you have any questions around it, we can always connect and explain that a little bit more. There is also a peer specialist legislation as well that is looking at certifying peer specialist. Right now, we are just following that as well. We will bring updates if at any point in time there's anything of interest for us specifically. And then, of course, I would share, because we have a mix of hospital and clinical partners around here, the nurse staffing bill is again back at the legislature this year. And I know that there is a mix of pros and cons against it. I know for rural healthcare will be really difficult to provide adequate nurse staffing when we are struggling already with adequate staffing for the workload we have in existence. Lastly, state more regional focused. We've always kept it comprised of the work that has been going on with the Healthcare Authority in our region for the chart model. Really, it has been on hold since the last time we've met. John McReynolds from North Valley Hospital was able to participate in a conversation with the Healthcare Authority and CMS to share some of the key concerns and reasons why none of the states and hospitals across the US signed on to the chart model. He shared an update at this last North Central Washington Hospital Council meeting with some optimism that CMS has heard some of that message and is willing to rethink how they were developing the original model. That said, our CMS committed to bring information back to the region in late February. So we're really in a wait and see holding pattern at this point. Our hope is CMS heard the states, heard our clinical partners, and is willing to make a change. But at this current juncture, we're not really sure if that will be true or not. If you go on the next slide.
Just 1 second, I'm having some.
No problem. And if anyone has questions, please feel free to electronically or always feel free to interrupt me.
This is Mal.
Sorry, go ahead. I was just going to say, I'm going to work on, you go ahead.
Okay. All right. I was just going to ask on, this is something that I asked John during our executive committee meeting. But we don't, as NCACH, have lobbyists, but the 9 ACHs do, correct? And we roll up to that information?
Yeah, so the 9 accountable communities of health have over the past year looked at how we become more collaborative and work more in conjunction. So in that mix, we are forming an ACH association. One of the things we really as a 9 need to promote and support is how we are in unity in conjunction with state agencies. So to help get that message across, especially with the Washington State Legislature, and now that we are broader than just a healthcare authority, we have hired a lobbyist to help get into the legislature and start doing advocacy and education work for us. Now, the one thing I would always say is that's still going to cover more high-level topics. It's going to be more broadly accountable community of health focused. So when there's issues that come up that are specific to our rural region or specific to North Central and in our area right here, then there's still a need to continue to look at how a individual accountable community health can lobby and support our regional partners.
Thank you. Thank you for that. Yeah.
So what you see on the screen here is just a brief list of our governing board meetings for 2023. I'm sharing this with you because what you will be seeing this week is meeting requests going out for our 2 in-person board retreats. So on May 12th, I want to thank CVCH. We will be up in Chelan holding a board retreat in person up there. And then October 6th, we get the privilege of going over to the Colville tribes and holding a retreat in the Spillum. So I think these are great times to really come. Things that the board has signified in the past is the ability to build relationships across board members. So I really encourage you guys to block that time off and make sure you're able to attend these meetings. We are choosing to do our general board meetings virtually for the sake of convenience and ensuring everyone is able to attend and participate equally. But that means it's that much more important to ensure that everyone is able to make the retreats in person and do it together. If you go to the next slide, just some other operational updates. You will see Sarah Krowski as well as Kristen Solberg on the and so we are going to have a section called out for the finance update and the finance committee update. So one thing just to put on your radar is we will be bringing forward, it's not on your agenda, but we will be bringing forward a decision form to request approval to move forward with an investment firm. As well as Sarah will share some of the details coming up, is that we're finalizing our financial forms for this year, moving into accrual-based accounting, as well as getting ready to release an RFP for an audit firm. And that should all be coming down in these next few months. I want to give a huge shout out to Mariah and Morgan, who helped facilitate and put together our first partner. The partner convening was held in January, and we had 53 people attending either in person or virtually. We had the focus this year on advocacy, specifically with the legislative session in play. And Morgan at the start of the convening did a really great job sharing how advocacy really ties back to our framework of the vital conditions, specifically around civic muscle and belonging, and how building up advocacy in our community, building up that civic muscle is important into moving the work along in our region. I also want to give a huge shout out to the Community Foundation in North Central Washington, whose facility that we were able to utilize in giving. I will also give you an update later on about some of the partnerships we have with them as well as the speakers we were able to have. And so we had the Nonprofit Association of Washington, the executive director, and another staff member be our primary speaker to share a little bit about how nonprofits can get engaged into advocacy and lobbying, which I think is very valuable because even all of us as skilled nonprofit leaders sometimes don't understand what we can or cannot do in the world of advocacy and lobbying. And so the more we can demystify that framework and demystify those regulations, I think is valuable for everyone. As well, we were able to have Representative Mike Steele join virtually to share the legislative session. We had Alana Maynor, who is also from Rural Board. I'm going to get the organization wrong. So Rural People's Voices. Senator Linda Evans Parlett was able to join us as well. And she was just able to share her experience around being a legislator and how people can connect with legislature, as well as Nancy Spurgeon was able to share some of her experience. So it was a great opportunity. I was impressed. Teresa Atkinson, I'm going to call out. I saw a lot of people from Grant County Health District there. So you either have now a highly skilled group of advocates in your organization, or people who are going to come to you with 100 questions that you get an answer now after we sent them to a training. So I hope that is okay. Our next one is, and she is throwing a heart and laughing or crying. So I'm assuming that is a good thing. If not, maybe she is just crying because she got a lot of questions. Our next convening is going to be focused on behavioral health. It's Friday, April 21st. And again, thank you to Del Anderson, who is going to be providing the space for that. If you go to the next slide.
Hey, John.
Yes.
Can you try to turn your video off? You're a little bit glitchy. So I'm wondering, I know you're in the office, but can you maybe try your video off and we'll see if that helps? Thank you.
Sure. To the office would provide you with better IT and internet connection, but I seem to be worse in the office. So other operational updates. Wendy and Sarah have been working with our local health jurisdictions to do behavioral health deep dive. The Chelan Douglas Health District specifically has been focusing on this in Chelan and Douglas County. Sarah, in conjunction with the North Central Washington EPI Consortium, has also been looking at this. And so really, it's just a great way to demonstrate how we can work across partners on different evaluation issues and find ways to partner together instead of doing these two completely separate efforts. And a lot of that, honestly, really comes together from having those conversations, communicating across the partners. So that is just valuable to keep that communication chain open. Also, kind of another huge shout out to Wendy. This last Thursday, we had a behavioral health workforce meeting at Big Bend Community College. So Dr. Julie Rickard and Wendy have been looking at behavioral health career pathways, both in the high schools and in conjunction with community colleges, looking at different programs that could be available. And so Dr. Bryce Humphreys at Big Bend Community College also has a lot of emphasis and passion around this. And so they had coordinated local businesses that have a focus with behavioral health or interested in hiring behavioral health workforce to come together to start tackling what are some of the issues and what are the needs around behavioral health workforce, and then how can they start looking at either apprenticeship programs, internship programs, certification programs, or larger degree programs to support and fill the behavioral health workforce gap. Regarding telehealth and digital navigators, We are doing a telehealth return on investment assessment pilot that will be starting over the course of these next few months. This is done in partnership with the contractor Ingenuum that we have been working with to expand and look at our telehealth work across North Central Washington. And we're hoping in the next board meeting or two that we will have more to bring back to you. Also, I see Jerry on the call here, and Community Health Network of Washington just did their press release on the digital navigator. We'll also be sending some materials out there as well. It's not the digital navigator program anymore, correct, Jerry? It is, Jerry, why don't you unmute quickly and provide the better term?
Yeah, so right now we've been, I'll put a link in the chat, but it's the NCACH Tech Help in partnership with the North Central ACH, but then also NCACH Tech Alliance and Bigfoot Telecommunications provider of the Cobo tribes. And so I'll put more information in the chat. Yes, NCACH Tech Help.
And again, it's just great to see a partnership between multiple agencies being able to provide a service back into our community. Another shout out to Sarah Bates, who has a measurement task force meeting this last January on the 23rd. And really I see she's waving and turning on her video at this point. Really, it's been getting started, getting the introductions going, identifying some of the data gaps that each partners have, and really developing objectives for 2023. So again, early on in the phases, but we really are getting this moving forward. And we have a great number of partners involved in that shared measurement task force. So more information to come. And then if you go to the next slide, fresh off the presses, I got this photo this morning at about 8:25 a.m. from Molly Morris. Our 4th Narcan vending machine has made it to rural in Grand Coulee. You can still see Joey needs to get out there and fill the machine and drop off some Narcan, but it is delivered. You will also see that it is promoting both the Rural Resources Star Hub as well as the Central Washington Recovery Coalition. So it's been a long way in the making. It has been the most testament to supply chain issues I've ever seen in a while, but it did make it to Rural Resources. And thank you, Molly and your team, for being willing to host a Narcan vending machine. And again, shout out to Joey to continue to get these things growing across our region. With that, I think are there any questions? Perfect. Then I will turn it back to Molly to pass it on to the next segment.
All right. The next segment then is the Finance Committee update with Sarah. Sarah Krosky. Take it away.
Hi, everyone. Hi, everybody. Thank you, Molly. First of all, I'm going to go through the financial statements. I want to apologize. It says September monthly board packet, but it has all the December statements. I apologize greatly for missing that on the cover page. So again, I want to remind everybody, this is the last cash statements you will see as we move into January accrual. So our ending cash for December was 21.7 million. Okay, and as we move into the income statement, I really wanted to point out that our total expenses were sorry.
Sharing something, or are you sharing it?
Morgan, I was getting things up, but can you share the board packet and the financial statements on the board packet for now?
Yes.
Perfect. Thank you. I wasn't able to get to that.
Oh.
So hold one moment, Sarah. Thank you, Teresa, for catching that.
No worries. I took away you go very seriously, apparently.
So is this what was in the consent agenda that we're sharing?
Yep.
Or, okay.
Does anyone know the page or we're going?
Yep, so this is page 10, right where you're at. Okay. So if you could enlarge it just a little bit to, I don't know, as big as we can, there we go. Okay. So these are the final numbers for 2022 as far as the income statement goes. As you can see, we had a total year-to-date revenue of $6.4 million. 6.2 of it is waiver bonuses and related items. And we had $210,000, sorry, in grant revenue. We do anticipate to grow this number in 2023 and 2024. With that, as you can see, total expenditures were $3.8 million, giving us a net income of $2.5 million. This $2.5 million will then go into retained earnings, which we will use in future years. Does anyone have any specific questions? Okay. From that, I want to make sure that everyone knows that I'm wrapping up some review notes, but a workbook of the accrual financial statements will be sent to the Finance Committee Friday. This is for their review in case they want to see things at a greater detail, or maybe they would like me to summarize other areas up a bit. So we're working on finalizing those templates into the 2023 year. Another thing that's really important for everyone to know is in order to have complete independence, CLA, although we love doing the books, for independence reasons, we cannot perform any audits in conjunction with NCACH. So right now what we're doing is we're coming together and getting an RFP put together to go out to bid. So that process is going to look a lot like the process I will describe on the investment side, but we're going to specifically be scoping out accountability audits and single audits separately. So the cost of them together would mean that we're earning more than $750,000 in federal grants. At this time, we don't need that. However, we're looking at scoping for a 3-year contract. So we want to make sure that we have those prices itemized out so we can do some proper budgeting. Okay. With that, I'm going to move us into the investment RFP. So as discussed in December, we're looking to put that idle cash to use. So we got an RFP put together and sent out early January. We got responses back from 4 of the 5 companies we did. So one of them was Morgan Stanley. We got a response from Charles Schwab. We got a packet from RBC Wealth Management, and we got a packet from CLA Wealth Advisory. So John, do you have that Excel you wanna, can we swap over to you?
Give me a second and I will bring up, do you want me to bring up the Excel document that had your original summary in it?
Yeah.
Okay. Let me find that for 1 second and keep talking and I'll bring it up.
Okay. So with this, we asked in the RFP for people to bring their best foot forward. Okay, we sent out our kind of guidelines in the RFP. We sent out the investment policy approved by the board, and we were available for questions as needed up until we chose who we were going to interview. So from the original RFP, as you can see on John's Excel, this is kind of what they brought their best foot forward in paperwork. Now, I'm going to explain a little bit about this. So it was really important to us because we are giving back to communities. We really wanted them to call out any commissions that they might be giving, whether that be to asset managers or to investment management or our financial advisors. No one who responded gave a commission. So box checked. Another thing that we really wanted to hit on was, what was your fee structure? Myriad of answers here. as you can see, and I'll go hit on them a little bit. But as far as their compliance with the RFP and the actual investments of the derivatives we had open, everyone met those targets. Now, and we specifically wanted to call out investment management because John's not an financial advisor, right? So he needs an ally and a teammate as we walk into this process. So Morgan Stanley, the reason that it has 16 basis points annually is they only gave us the price for their asset management. So it's 16 basis points a year, which equates to about 0.16% of the annual portfolio just to help John. So that didn't include any of the transfer fees or transactions done by the asset manager. So we kind of said, sorry, Morgan, you're out. Then we looked at Charles Schwab. Charles Schwab was the most competitive at the price per transaction. So that meant the transfer in had a cost. As we laddered things, that would have a cost. And as things came to maturity and rolling them into the next round of bonds or treasuries, whatever we were in, that. However, due to our conservative investment policy, they do not have an investment manager that could ally with John. Now, as we walk into RBC and CLA, they were pretty much the same. The major difference was actually just in strategy. So RBC is like a big bank, and they subcontract out to all these different financial advisors, and you pay 0.5 basis points or 0.5% to use them. And then no matter who you pick that they contract with, depends on the range. They've got a different range of fees, which is why this range of fees of 0.90 annually is so wide. So depending on how we invested, depend on which of these little financial advisors we used. Okay, so CLA is the exact opposite of that, by the way. So they're one advisor, and they utilize several banks. So they went out to bid and got several banks. And so they work with Charles Schwab, and Charles Schwab's fee is in here as part of the fee structure. So CLA normalized an average number of transactions and embedded it in there. So the CLA fee that they quoted in the RFP was 0.4 for just the CLA advisory services. And then the 0.05 up to 0.12 was the asset managers or the bank that we chose to go with and their trading. Okay, so what does that mean on a broad picture? On a broad picture, that meant the investment committee or the finance committee wanted to get a presentation or basically an interview with RBC and CLA. So both came to the table, both did great presentations. Couple of the takeaways was that RBC had a lot of options available, but they are hardcore investors. CLA works with people on their level, but utilizes normalized banking. So they're going to go in and find the best banker for you, right? So cuts down the options just a little. So I want to take a moment to make sure that Peter, Teresa, and Rosalinda can chime in with their perception of that before I move on, unless they feel I captured all of it.
I have anything to add. You did a great job.
Thank you. Silence being had, we decided to go with CLA because they came actually to their presentation with lower fees. So they had gone out and done a market, I'm going to butcher this word and I apologize. They went out and built a portfolio as part of their presentation. And as part of their presentation, they brought lower fees to the table because they had gone in detail for this presentation that we asked them to do. And so their new cost in dollars, not just percents, because it makes everyone's head spin, is between $52,000 and $67,000. This is about half of what RBC's was. And so today, we're going to put a motion forward to move forward with CLA pending our final reference checks. So I was not able to get final references from the wealth advisory side to round out our decision. So we are wanting to move forward with the contract process with the board's approval that if we hear reference checks, that we can pause for the cause and come back to the table. And I'm done.
There. Okay, I was just looking for the board decision form. So
Yep.
you can all see it is in your board packet as well.
It is not in the board packet.
Oh, this one is not. This was the one that was not. Okay.
Yep.
So, an investment firm selection by North Central ACH. So approve the, wait, that's not it. I have two of them.
And while Molly's looking at that,
Oh, this is it.
Molly, can I just make a quick comment?
Yes.
For me, especially, I feel like Clifton Larson Allen just fit where we really are as investors, as an organization. We're, in our beginning phases of this exploring, we're in a lot of a learning phase. And so at this current juncture, what they brought to the table was more in that vein, where, to be honest, probably strategy and investing, which RBC, to give them credit, I think, from my understanding, from what I heard from Sarah and what they present, is they are a big time investment agency, and people are ready to really get deep into investing. They are a great place to go with. But CLA is way more formed to help those beginner investments really get into the work and get in.
Thanks, John. All right, so the background is that at the December board meeting, NCACH board members approved an investment policy for the organization and supported the finance committee in releasing the RFP for investment firms. It goes into the 4 different proposals that we received. Based on the presentation and alignment with NCACH's risk tolerance and investment goals, the committee is recommending that the board approve Clifton Larson Allen as NCACH's investment firm. So the proposal is to enter into a contract with CLA for investment management purposes, pending no issues with references provided by the company. And the impact, this will allow NCACH to further grow funds sitting in its accounts until we're ready to expand in a health improvement purpose, and then allow us to evaluate how we will do this with additional funding that may come into the organization. At this time, I will entertain a motion.
This is Ken. I will make the motion to accept the committee's recommendation.
Thank you, Ken.
Manuel, I second.
Thank you, Manuel. All right, so we have a motion and second on this. I do see that Maddie Osborne, thank you for letting us know that you do have a conflict, so we can abstain. Any questions? Hearing none, I'll call a vote. All those in favor say aye.
Aye. Aye.
Aye.
Opposed would be nay. We have the 1 abstention, and there are absentee that are noted in the minutes. All right, thank you. Motion carried and approved. Thank you.
And I just want to give a shout out to Sarah, who really spearheaded all of this, handled all the questions from the investment firm, and really got this process going. It may not sound like a lot of work, but it is a lot of work. Maybe it does sound like a lot of work. And I know she fielded a lot of questions. And I am also really impressed at the turnaround time that the investment firms came back with when we had questions or time to schedule meetings.
All right, and now it is NCACH strategic goals with John. 3-year strategic planning.
So as Molly had asked earlier around, I can't remember if this was before the meeting now when everyone got on or during the meeting. She had asked the question on where we are going forward with looking at our strategic priorities as an organization and where we want to head in the future. Through the Medicaid Transformation Project, we, for the most part, have had a 5-year plan or a 5-year direction that we had originally created under the Medicaid Transformation Project Toolkit. And in the early years, we were really planning and projecting to move along with that work. And of course, as you all know, the original idea was that, you know, in the early days, we were actually probably going to be in the process of dissolution this month or next month. But a lot of that had changed in 2020 when we updated our mission statement, and 2021 when we improved our pillars, and we were looking at how do we become a valuable organization to our region post Medicaid Transformation Project. We had in 2021 and 2022 been working with the strategy work group to really develop a strategy that really builds out how we're going to build a network and infuse that work into our network. And that really has developed into one of our core strategies that you'll see on the sheet here. But barring that, outside of the strategy work group work that has been done and the development of really that first strategic priority, and then also informing the second strategic priority around how we want to move forward with health equity. NCACH still does have a book of business outside of that strategy work group that's going to be tied to other projects that come along. A good example of that is the Medicaid Transformation Project waiver renewal, where ACH just across the state of Washington is that primary vehicle or mechanism to bring that work into our region and complete that work. And so there are going to be components of that waiver renewal that we still need to complete as an organization, whether it directly is the direction that the network is going or not. What we really need to do as an organization, though, is make sure that all these priorities are crossing each other and are weaving together so that they are in alignment and not separate from each other. So what I wanted to do today, with all that said, is just really start going into where we are thinking strategically over the next 3 years as an organization, and to give the board an opportunity to really start digging into questions and comments that you might have around this direction. I wholeheartedly will admit that these strategies have been developed both from myself and from the team, and it was shared with the board at the October board retreat, but it's primarily been driven internally with the organization and the staff. What I would love to see moving forward throughout the year is that we have an ability to revisit these on occasion and have board members actually looking at some of these higher level strategic priorities and providing feedback in if we're hitting the mark, if they feel like we're hitting the mark on these strategies, or if we should be looking at ways to amend them so that they are more in alignment with the direction that we are moving. With all that said, Morgan, can you go to the presentation page? So first thing I really wanted to do was, as we start this year off, is recenter and refocus on our mission. You've seen this a number of times over the course of the last year and a half, but it's always important to recenter on what our mission and reason of being here is. So I'm not going to read the mission word for word, but again, this is a reminder that in 2020 and really starting last year, we lived into our mission focusing on whole person health and health equity. So we have really become an organization that has moved away from a clinical quality improvement focus to how we are improving health and well-being in general across North Central Washington. An easy, tangible example of that financially is that we've shifted over the years to more greatly financially support in our work community-based organizations than clinical partners. So moving from really how do we improve things within the clinical walls to how we improve things across our region. The other thing I would note and put a focus on is that we moved from really that project management centric focus to really looking at how we support collaboration, driving systems change, and engaging and unifying stakeholders. So we are a regional entity, and we're really trying to live into that regional entity work. And we're also really trying to live into how we do this by engaging partners to collaborate with each other. So a lot of the focus and a lot of the work that we have been engaging in, especially this last year, has really been focused on cross-sector collaboration and building partnerships. And as we move forward into the future, I feel like that's where our value really stands, is how are we connecting both clinical and community partners together, and how are we connecting partners across the region. If you go to the next slide, as you all remember, in the fall, we presented to the board, and the board endorsed our vision of thriving, all people and places together, no exception, as well as the framework of the vital conditions. This is important because what you're going to be seeing in some of the next few slides, and what you're going to be seeing in us this next year, is we're going to start tying a lot of our language and a lot of the work that we do to both thriving and the vital conditions. Again, I give a huge call out to Mariah and Morgan, who did a great job just within our partner convening, linking it back to what was the vital condition that really spoke out in our partner convening, and that was belonging and civic muscle. You'll see, and Morgan has done a wonderful job starting to tie even the newsletters and the segment I do in the newsletter to a specific vital condition as we go throughout each month, releasing any news or communications as well. So as we go throughout this year, what you're really going to see as we engage in the different work we do is how we continue to tie it up with our mission, how we continue to tie it to our vision of thriving, and how this work really funnels under the framework of the vital conditions. One thing we did as staff that was very informing was we actually, a couple of weeks ago in one of our retreats, we took all of our direct work and we started to figure out which vital condition each component of our work may link to. We included, and I know you've seen the wheel before in past meetings, the vital condition wheel that includes both upstream and urgent services. And actually, to our surprise, what I would say is that we are already engaging in more midstream and upstream work than we actually anticipated as staff. We thought we would look at all of our current work and that it would all be a bunch of Post-its on a board, all in urgent services, all focused on the downstream work. And what we're finding is we're more evenly split, if not even a little bit moving to midstream and upstream work, and we are really moving into the vital conditions. And so we are actually pretty far along in that transition of really focusing more upstream in what we do. If you go to the next page. The other thing I wanted to call attention to, and I'm going to allow everyone to read this, is NCACH's equity statement. So in 2020 and 2021 specifically, we did a lot of work, including with the board surveying and gathering feedback on what health equity and equity meant to the board, what health equity and equity meant to our organization and staff. And for those of you who were on the board at the time, you may remember the education we read through, some of the documents we put together associated with equity and health equity. And what we decided to do internally and to get it really more forward-facing is boil it down to a specific statement that summarized a lot of what those documents said and summarized where our organization currently is at and how we engage in equity. So I'm actually going to take a moment to pause and ask everyone just to take this moment to read through that statement, because I am not reading that word from word. So as you finish reading that, I think it's important, again, to revisit the statement as we go through our work. Because again, even as we engage in our mission, as we engage in our vision of thriving and the framework of vital conditions moving forward, we also want to make sure we're doing it in an equitable way. And so as you read through this statement and you read through the work that we do under each one of those conditions, we always want to come back and visit to make sure that the work that we're doing under a vital condition is also contributing and moving us forward in the statement that we have around health equity and equity. So again, we will revisit this a little bit, but again, I encourage everyone to keep this at top of mind as we go through and we continue discussions. And that's why we do revisit it, is because it's easy sometimes to read and forget, but it's great to continue to bring it back to your consciousness as we engage in our work. Next slide. So this is just a quick refresher and reminder at our October board retreat, and I apologize for you new board members because you didn't get the chance to go through this. The staff went through a series of eco-cycle planning and sharing with how we have been thinking about the progression of all of our work, all of our programs, and all of our projects over the whole organization. And so you'll see on here two key programs or focuses that we have had under network support and behavioral health. And I apologize for those of you who cannot see the smaller cards on the image, but what we did with the board at that time is we started to go through where we felt we were at in our programs. Were we in gestation, where we were starting to bring them to life? Were we down at birth, where they were coming into fruition? Were they developing maturity and growing, or were we even at the bottom right stage at creative destruction, where we were really getting through that maturity and going through that cycle of determining how do we reinvent, redestroy, recreate what we've been doing to continue the cycle of improvement. And so we went through that with all of our different programs and projects. And what I go through today, and even with the vital conditions, that doesn't change that as an internal process that we do our work and how we visualize continuing to expand our programs. We will still continue to do that throughout the year. And likelihood is we will also still find a time at another board retreat or board meeting to go through this process with the board as well, so that you guys, again, get a good sense of how we are visualizing the different programs that we are doing and what stages they are at, what are some of the struggles that we have with the program. So again, that gives you kind of an understanding of that direct boots on the ground work we're doing as we come back and start to talk about some of the higher level strategies we want the board to start strategizing on in the future. So I'm gonna, before you click next and they start looking at the screen, we're going to really start moving into those strategies. What I am sharing today, again, is each strategy is really focused on looking at how we built this out more over a course of multiple years. I really want us as a board and as an organization to start thinking about how is our work going to occur over 1, 2, or 3 years. Sarah's been doing a great job on the fiscal side, even saying how are we budgeting for work over the course of 1, 2, or 3 years instead of just doing annual budgeting. I think even our move to have restricted funds that go the longevity of our organization is one way that we've started to move in that direction. But what you will see also in there is some of the current work we are doing that may be just things we're trying to achieve this year, or maybe things that are taking multiple years. And so if you go to the next slide, again, with that in mind, one of our key strategies, and the first strategy that really came out of the work that we've been doing with the strategy work group, which is now moving into more of a community-driven stewardship council, is the first strategy up there, which is support regional action and collaboration by bringing partners together with a shared framework. So the way that you're seeing this come into life and the strategy get operationalized at the organization level is how we're bringing partners together under partner convenings on specific topics and specific issues that have been identified by different partners across the community that they want to hear about. So this last year, NCACH started what was called a learning task force, and the learning task force was focused on developing topics and agendas for these partner convenings to bring individuals together. So the first one, as I said, occurred in January that was focused on advocacy. And again, we will have one quarterly and one in April focused on behavioral health. As well, we're building how we visualize our network by developing a stewardship council, or really the progression from what was our strategy work group, defining the strategy at the board level, to the stewardship council, which will be the group of community partners building out this network and understanding some of the structure underneath this network to make it come to life. As well, I would also call out the shared measurement task force that Sarah is starting and getting up and running, that will be doing a lot of work over the course of this year, identifying goals and objectives, connecting with local coalitions. We are going to have a focus this year to get out and do increased community engagement to get our name out there in the community and build our partnerships. And we're going to focus a lot on our communication. And one of the reasons in the year past, we expanded our communication manager's scope of work from 0.5 to 1.0 is that realization that we really need to expand and build out our communication strategy and our name as NCACH. A lot of what you see under here really in this year is engagement, outreach, building, and planning. So that's just to signify that a lot of this first year is going to be focused on getting the structure in place. And our hope is throughout the year that we will be able to move in more of an implementation phase. But the primary focus really is structure and planning at this point. If you go to the next slide. Strategy 2 is focused on advancing health equity and civic muscle through learning, investment, and advocacy. So we have had a number of talks, both at the board level and internally, about how we can continue to build capacity across our region and support our partners in building capacity. And so you see this in the work that we've done this last year in the partnership that Mariah will be sharing later today with the Nonprofit Practice Institute, which includes both the Community Foundation in North Central Washington and the Icicle Fund. In the community review committee that we have put together that Mariah and Caroline have worked on, that brings community members with different experiences and background together to look at the different partners that we are investing in and making or submitting proposals that we would invest in and making recommendations, so that it's really a test of a community-driven process, a community-decided process in how NCACH invests some of its money. The support with the North Central Washington Equity Alliance, and our hope is to continue to grow that partnership. We invested this year in supporting some of their training work over the course of the year. We are encouraging staff, and we will also be encouraging board to participate in some of the North Central Washington Equity Alliance training. And we really hope that you guys get out there to get to learn that organization. In regards to equity education and equity advocacy, we're going to be one of the organizations that are going to be one of the primary drivers and leaders in our community. We're going to be looking at board structure and internal governance. We're going to be looking at the shared measurement task force and how we look at data through an equity lens. In the telehealth and digital world, we're going to look at digital access to care. So you can see a lot of that is really how are we working with our different community partners to build that capacity and that structure. How are we looking at it through an equity lens? I'd say this also signifies, when you look at equity lens and data, how a lot of our programs and projects are going to cross over a few strategic priorities. And we did, as a team, do some mapping to look at where some of that crossover occurs so that we can continue to track how that moves these different priorities along. If you go to the next slide. The third strategy that we're really focused on is to support the care coordination infrastructure across North Central Washington. Board members who have been here for a while can remember that in the middle of the Medicaid transformation project, this was actually early 2020, just before COVID hit, we decided as a board to discontinue the Pathways Hub program in North Central Washington. At that point, we had made a decision to really look at what care coordination needs we have across North Central Washington. And we've been looking, expanding, and growing that understanding and that work over the course of the last year and a half. And Caroline Tillier has been the staff member who has really been driving and leading that cause. Just an easy example is we spent an hour today with the Healthcare Authority reviewing our vision for community-based care coordination and asking questions about their vision for community information exchange as we continue to engage partners in our region and how we work collaboratively across partners to build a care coordination infrastructure. This has always been identified as a need in our region, but also this is going to be a key focus in the Medicaid Transformation Project waiver renewal. So this is one thing in regards to an ACH that will always be a key strategy for us over the course of the next few years, because we're going to be one of the ways that this work gets completed with our contract with the Washington State Healthcare Authority. So I think it's important to recognize that this work is going to continue. We're going to always need to be a strong advocate in our region for this work. Doesn't mean that we need to do it always, but it means that we need to support our partners and make sure that we have the processes in place to do that. If you go to the next slide. And then the other key strategy is really to support the behavioral health system of care across North Central Washington. So this really has been an evolution of two key focuses that came out of the original 1115 waiver. One was really focused on our whole person care collaborative and outpatient behavioral health primary care and our clinical acute care partners, as well as the work we were doing under the original opioid crisis response. So for our clinical partners, we really started more broadly with outpatient care. Some of that also included bidirectional integration. But at some point in time, as we moved away from the waiver, what we really knew was a need was figuring out how we address gaps in the behavioral health system. I think that's valuable because there's a number of players in the behavioral health system that are smaller and a little bit more nimble and we can engage in. So we are engaging both in community-based partners, behavioral health providers, and primary care providers and acute care providers and how we do this work, but really focused less broadly on clinical care as a whole, but more focused on behavioral health. And so we've had a behavioral health work group going on over the course of the year that's actually moving some of its work into implementation with recovery coaches in emergency departments, as well as putting peer specialists and peer support in library systems. This also comes in with the work that we have been doing with Hope Squad over the course of the last 3 years, which was initiated by funding we received by Cambia Health Solutions. And as you all know as well, our original opioid work really transformed in 2020, 2021, really to a focus of recovery and recovery supports. And that's when we hired Joseph Hunter, who is our recovery coach network manager. And we had a 3-year commitment at that point in time to really expand and build out this recovery coach work. And so we are entering year 2 of that this year. Next year will be year 3 fully into that work. And we're going to be evaluating over the course of the next 3 years what we will be doing with recovery coach work. How do we make it sustainable? And then where are some of the most appropriate places for this work to be occurring? What aspects of it is important to keep in NCACH's wheelhouse, and what aspects of it is important to ensure that we have built in our community partners? And I think that's the last page. Oh, nope, I do have 2 more pages. I'm sorry. So really, those are our 4 key strategies. Like I said, they've been primarily informed by the staff. We shared it at the October board retreat. We were able to use that in conjunction when we went through the eco-cycle planning. We came back as an organization and made some edits and adjustments to those. And then we are bringing it back today, again, to center the board on what those strategies are and our thought process around it. What we are hoping is that the board takes a look at this, has a chance to provide additional questions and responses back. We're not going to necessarily get to all of them today, but then that we start utilizing this as a way to evaluate at the board level, what are some key strategies that might be missing in this mix? What are some key strategies we should be looking at testing? Or are there questions you have about other things we've considered under the 4 key strategic priorities we have? So I'm listing on the screen here today. I'm wholly going to admit this is my goals for the board. But really, what I would like to see is our board look at the change in our board composition to support this work and support our structure moving forward. I would love the board to start looking at some of these strategic priorities, aligning around it and seeing where we can move forward with it. Center our governance on equity, thriving, and the vital conditions. And ultimately, I want us to start talking, especially as a board and as an organization, multi-year, our vision and our plan. So not what we're going to do this year, but what we are resetting ourselves up to do for next year, the year after that, and potentially the future. And those are the conversations I would love to start engaging with more frequently at the board level. And then if you go to the next slide. So just looking out ahead, you can see, again, I shared a lot of that on here on this screen, is really bringing this back to the board at a routine basis. Looking at future capacity needs and funding to achieve those strategies. And then also, as we get halfway through this year, I'm going to be honest, more of the information around the waiver renewal work will be coming into play. And so things like that will also inform how we look at these strategies in the future. Likelihood is we will be making potential modifications with that. I never want to change these strategies to chase a contract, and we'll always make that statement clear. But I want to make sure that the work that we are doing are in alignment with strategies. I guess I would open up as you guys read through these, and mostly that one pager. Is there anything that sticks to your mind that you would like to comment on, or is there any key questions you have at this point?
So John, this is Mike. I do have a question about the care coordination piece. I think there's a group now that's in Okanagan County that's looking at, that is a HRSA grant to start looking at care coordination across Okanagan County. Do you know anything? Does your team members know anything about that? I think FHC may have the grant.
Caroline, I may defer to you. I am not specifically aware of the HRSA grant, but you may have heard of it.
I think I have heard of it. I also know that there was another HRSA grant pursued around palliative care. And so we are trying to connect all those. Yeah, we're trying to connect all those dots. And some of it will be more on the kind of healthcare coordination side of things versus the community-based social determinants of healthcare coordination side of things. But obviously those things connect. So we're trying to incorporate things. Yep. Is that the one you were referencing, Dr. Tubby?
Yeah, I think that, I mean, because it's the same group that had a palliative care grant as well, and they're working on, how do we get the healthcare organizations and social organizations connected together in managing these complex people and their care needs and SDOH needs. And I think it just feels like that process is just running on its own outside of any connection to NCACH. So I think I want to try to get them connected to you, so we can at least have that conversation about what are you trying to accomplish, because they're talking about getting a common platform for communications, which sounds a lot like what the state wants to do.
And actually we did, if I think this is the exact one that we connected with, we actually submitted a letter of support for that HRSA grant for the palliative care, because we knew that they were interested in a platform, and I've already talked to the folks up there about potentially being able to leverage the one that we're investing in if it will meet their needs. But again, that around the care coordination and platform questions, we're not always going to be able to land on the same platform. So the question is, how do we ensure that data exchange can happen between different platforms across a network of partners? So, but that's a good reminder to circle back with them. And any connections you want to help make, I totally welcome, Dr. Tuggy.
Okay. All right, Carolyn. I will send you, I know the physician who volunteered who's on that group, and then also I think Tawny from FHC and TWISP is the main person down there that's working on the grant side of it.
Okay. Thanks.
Okay.
And Dr. Tuggy, that speaks to, as you see all this, like we said at the start, the focus is on collaboration and bringing individuals together and working across sectors. So the value of the board we have is you guys are eyes and ears into work that's occurring, that we may just not be able to see because every individual has their own bandwidth. So as these things come up, that is just a perfect example on how you guys can bring value back to this org. Other questions or comments?
So this is Nancy. I also am just sitting and listening because some of you know I am doing this interim role at the college right now. And the Wenatchee Valley College is the new area health education center for Central Washington. And so I'm playing this interim role as their director right now. And I see that as a place too to start connecting, you know, as all of these, it's kind of like all these things are going on, right? And how do we kind of leverage our resources together?
Yeah, and I know Wendy joined your first meeting today, correct?
Yes. Yeah.
So anyway, it would be worth having a conversation on how the AHAC work links together, because I do think that looking at workforce in greater detail in the future, there can be some value and connections with the ACH. We may not be able to solve every workforce need, but there's certain areas that we could really connect and support with, especially similar to what Wendy's doing with some of the behavioral health pathways.
Right. Yeah.
And Wendy already told me that we need to volunteer you to speak at a few different places.
Okay.
As the new interim director. Peter. You're still on mute.
Yeah, Dr. Tuggy raises a really important question when, you know, things like the palliative care grant come up that look like they're, you know, right at the heart of what we're trying to do. It's a question of how do we leverage that? How do we support that? How do we not, you know, get in their way of doing, you know, what they're organized to do well, but somehow build on it. I'm pretty familiar with the grant and the work, and it is very specific to palliative care, but I'm sure it has implications for care coordination writ large, and it's just a question of what's our role in all of that? How do we help versus get in the way? How do we generalize these kinds of things?
Yep, and we see that same thing even with the Coalitions for Health Improvement in Our Valley, Our Future, is how we don't get in the way of local, but how we enhance it. And where it's important for us as a regional entity to come in and provide that support. There's always going to be that unique tug and pull against each other to figure that out. Other comments or questions? Well, we will be revisiting this throughout the course of the year. I would again encourage board members to read through specifically that one pager. And if you in the immediate future have any thoughts or comments, to send them to me, and I'm happy to schedule additional one-on-one time with board members to talk through it, to get those questions answered. Sometimes an individual conversation is the best way to really dig into some of these topics and get a better understanding of them. With that, Molly, I'm going to turn it back to you.
Right. So we've been sitting here for a while. I'm going to go ahead and have a recess for a break. And we will return at 2:30. It's a little bit longer, but we'll stay on schedule that way. So I'll have everyone back here at 2:30. All right, I'm going to go ahead and start the meeting again. Welcome back, everyone. I was able to get quite a few things done during that time. So next on the agenda, board composition and governance survey. So Sarah Bates and John, go ahead, take it away. Thank you.
So I get the joy of just introducing this, so you don't have to listen to me much longer today, but this really came from in the December board meeting, and even in, I believe, the November board meeting, when we were looking at filling positions or changing board positions through the nominating committee. And at that point in time, especially in the December meeting, we decided not to fill or change the Hispanic consumer seat, the Hispanic seat, the consumer seat. And we actually paused on filling the Confluence Health second seat until we had a chance to do a bigger deep dive into our board composition and how we can start adjusting it to meet our future needs and to better represent what our community looks like as well. And so to kick that off, one of the recommendations was to do an initial board survey to look both at composition and skills and start getting an understanding of what our board looks like and how that compares to the region. And then looking at the next steps for a deeper dive. And so Teresa, Morgan, and Sarah have been working hard on that and putting together the information. And so Sarah's also been able to pull a lot of statistics regionally and nationally. And so I'm going to turn this over to Sarah to give you a review of our board composition and our skills and what it compares and looks like. And then we'll have a recommendation at the end. So you're up, Sarah.
Great. Thank you, John. And thank you all for filling out the survey. It was very helpful. So one thing that wasn't directly on the survey, but we just wanted to kind of bring up is what the distribution is across our counties. And so you can see kind of the population percentage for each county in our NCACH region, and then the percentage of NCACH board members working in each county. So we had to kind of decide, is it working, living? How are we going to do all of this? So we went with working, and just remember that there's 5% MCO since they cover the whole county. And then also the open seats that we have is 10%. So there's more members that could be added. And it might be surprising that 40% of our board works in Grant County, but that's important to point out. And then next slide. We just asked how long you've been on the NCACH board, and I just put most of the national survey I took from just the 2021 board source leading with intent survey. And so you can kind of see nationally what other boards do in terms of length of terms, maximum number of terms served, that type of thing. So that's something just for you to look at and have an idea. Teresa, just saying hi. Okay. Then we jump into just the diversity on our board for ethnicity. Again, our survey results are somewhat close to our regional data. I did make a quick little note here for the regional data, 5% for American Indian or Alaskan Native. I actually broke that out a little bit more by county, as Okanagan County has almost 13%, which is close to what we have on our board. So I think that that is actually a better picture of how close we really are for our board composition. Also, the National Board Survey, you can look at, they break it out actually by chief executive, board chair, and board members. So that can also just give you a little bit more insight into how that actual breakdown is. All right, and then we looked at gender. And so our region, pretty close, 50-50 male, female in our board. We have almost 67% female, 33 male. And we did ask about non-binary and prefer not to say or other, which in terms of like, we don't have regional data, like census level data for that. But maybe that's something we can look into a little bit more and see if there's any diversity there that we need to look at. Again, the national data looks at the 3 different kinds of positions, and they did ask about non-binary and then also transgender. So just something for us to keep in mind. And then for the age, we're definitely on the older end of things, especially for our region. It's good to note that the regional age categories were actually broken up a little bit different. So this is maybe more of an estimation of how closely we are for our region. That being said, yeah, just something to keep in mind. So then we looked at more of our skills on the board. So as you can see, 80% of our board is involved in policy development, strategic planning. We have a high percentage of state and federal advocates here on our board. And so we just want to make sure that perhaps in our governance committee, that we want to just double check, are these the skills that we really want to prioritize? And are there other skills that would really benefit the board? Do we wish that, more than a third had grant writing experience or risk management, perhaps? I don't know. And then in terms of looking at what other priorities we might look at for board recruitment, this is just again from that board source survey that 98% of boards look for passion for the mission when they were looking at recruiting. So these are just maybe some other little ideas to kind of keep in mind as we look at recruitment. So again, when it comes to board diversity, they looked at within the boardroom, how much is age, gender, sexual orientation, race, or ethnic diversity, disability status, and socioeconomic status, how important is that inside the boardroom? And then as external ambassadors for mission. And so then again, this is from the board source national survey. So we looked at age and gender, race and ethnic diversity. But one thing that we did not look at was socioeconomic status, which they also found to be somewhat important. And so that might be something that we look at the next time we do this survey. And in terms of socioeconomics, I did look, go ahead, Morgan, next slide. Look at some of the socioeconomics of our region. So looking at, if we were looking at socioeconomics, where might we fit? You can kind of look and see for yourself where you would fit in terms of, are you above or below the median for household income, per capita income in the past 12 months? And in terms of if you have any lived experience of living in poverty. So that's just an example of some numbers that we might look at in the future. And I think the importance of this whole survey and looking at the different regional and national surveys is that those organizations that define the desired mix of diversity, skills, and connections that the board needs, those that use that as a starting point for board recruitment were more likely to report that finding new board members was easier than organizations that did not So just by planning and knowing what kind of diversity we would like to see on the board will put us ahead in our board recruitment strategies. So that's where I'll end. Questions?
I know we ran through that pretty quickly, but
yes.
Was any, just one or two board members would like to comment, was any of that surprising? Did you expect to see generally that information to be about what you saw? Does it make you ask any questions about what we could do moving forward? I see heads shaking. One or two could jump in. Carlene, I'll pick on you.
Yeah, absolutely. I mean, it's always nice to actually see what we think we see, right? And so I appreciate the numbers very thoroughly. I actually I screenshotted my stuff there, so I can use it in other things. So thank you. I think we're going to be active in finding more people.
I'll jump in. And sorry, I was looking through here, but I don't know if I saw some of our, well, I did see some of our regional data. I've always, you know, championed the line of thought that, you know, our leaders and our board makeups should represent the demographics that they serve. And if that's not reflected there, what can we do to ensure that?
Yeah, and I think part of this whole thing is kind of defining who are we serving, right? Is it the organizations? Is it our, you know, general population? And just making sure we can then kind of coordinate that regional aspect of it. That wasn't necessarily like super clear when we did the survey, right? Of what we were looking for.
Yeah, one of the only qualifiers we've really had in our original board composition was that 50% or less of our partners could be clinical partners on the board. And that was really an agreement in the initial Medicaid Transformation Project waiver. But that was the only requirement we had. And I think based on some of the original planning from the group that was volunteer and put this together to begin with, there was a focus on trying to figure out in that original waiver what were the key players we needed to have at the table. And so we did come up with a sector structure that was really beneficial to implementing the initial waiver. So now it's kind of time to look at the next phase of what this really looks like by looking at, as Sarah said, what organizations are important to have engaged, as well as how do we best represent the community.
There are some comments coming in.
I believe every board member completed the survey. There were 15.
We might have missed just one.
Okay.
So, and I can't remember who it is, so, and that's okay.
But it was close, at least close.
Any other questions or reactions from seeing the data?
I know that the one piece that we have the hardest time is with the consumer to get that voice of the community. So, I mean, I'm always looking for that piece. Who can fill that voice? It's a voice that's missing.
And what do we mean by consumer? What exactly are we looking for from that seat? Is it socioeconomic? Is it lived experience with mental health or SUD? What exactly is that? Because I think that can help, you know, there might actually be representation on our board already. We just didn't ask the question. So that might be a future thing, is a little bit more anonymous survey of, you know, have you ever lived in poverty? Have you ever struggled, right, to pay a bill or find
I think as a community health worker, I kind of bring part of that to the table, being that I'm on the ground level working with all who come before me. So yeah, thank you. That's a good point.
Mm-hmm.
I think the other internal discussion we've had just for board members to think about too is when you don't necessarily have that representation on the board of a specific group or demographic, how do you continue to infuse and educate some of that knowledge in your decision-making process, whether it is bringing individuals in to speak about their lived experience so that the board members can become more knowledgeable, going out and seeing things out in the community. So we may not always get 100% representation, but in those areas we have a deficit, there is sometimes, I feel like, an obligation or a way to better us by learning more so about those aspects so that we can continue to keep it in our mind when we make decisions.
Not that this is the best, but I guess it doesn't surprise me at all on all of the data that you showed that board members tend to be older rather than younger. and I think that has to do with capacity to volunteer one's time. I think that it
mm-hmm.
You know,
I agree. Not surprising.
Yeah.
Nancy, I was going to say I was shocked. So
I think, and you know, we also appreciate the wisdom that, you know, additional years provide. So
some of that though also can go to the kinds of positions that sit on the board and the age that it takes to get to a position, right? So if generally board members are made up of higher level positions in an organization, sometimes it's hard for younger individuals to get to that level.
That is true as well.
I do like the question about asking who is our constituents, because it does feel like we're trying to work with organizations and organizational leaders to help them really work together. And if that's truly our constituency that we're working with, then the board representation may reflect that leadership team or those leadership groups that we have around all these different organizations. But I noticed there's nobody from 18 to 30 in the board. It is really great to find some young leaders to bring onto the board, to a board like this, because then they start getting experience in leadership and strategic thinking and planning much earlier in their careers.
I think you could also argue that if we're looking for equity, that younger people are disproportionately disadvantaged, in the modern economy, and that having more of those voices would be helpful.
If there's no other questions, Morgan, can you bring up the screen on the decision form? So really the recommended next steps, and then I'll turn this over to you, Molly, is to form a governance committee to dig into really board composition and looking at how we can make some recommendations moving forward. I'll be transparent to say we were looking at a charter or a structure for this this last few weeks, and we brought back the old governance committee charter we had. Carlene will remember this at least, and it had components that include board composition potentially as a task to look at. So we actually are bringing that back as, again, a group to form that we can look at, that can spend some concerted time this year looking at this and bringing recommendations back to the board.
And it is in the board packet, correct? Can that be brought up?
Yep.
Thank you.
I think, Morgan, you're looking for it, correct? So you'll see on page 37, the governance committee charter. And the only composition change I would actually make on this is we have 4 board members interested and or willing to be on the committee. So I would change that to 4. And then on the next page would be the board decision form. And based on the survey, we asked who would be interested in being part of a committee. And so we, prior to this meeting, proactively reached out to a few individuals that expressed willingness. And those individuals were Manuel Navarro, Deb Murphy, Linda McKay, and Carlene Anders. And we didn't put names on here because I didn't have full confirmation until today, but luckily chat messages can do wonders in confirming. So I did shore up some confirmation during the meeting. And so those are the 4 individuals interested and are willing to be on the committee to go through this work.
Now, I would imagine they interact with the nominating committee as well, or are they independent work?
I would think this would supplant the nominating committee, would it not?
This is predominantly focused on recommendations to changing the bylaws to composition structure. So when we get back to annual appointment, I think the nominating committee would take this on. We talked about, and Molly and Ken, I don't know if you remember, we talked about this originally both in the nominating committee and the exec committee, and the recommendation was to do something completely separate. Okay. So this isn't appointing anyone to the board. This would just be recommending a structure in place that would replace what is currently in our bylaws.
Thank you.
Yeah, I want to make sure that got discussed. Has everyone had a chance to look at the board decision form to approve the governance committee charter? Approve the charter for board member composition committee. At the December board meeting, board members decided to hold off filling board positions to look at the composition of the board and decide the next steps. And to initiate this process, we initiated the board skills survey. Purpose of the board skills inventory survey was to provide background experiences to better understand the current board composition. Results from the survey can be used to identify additional skills or life experiences that would further diversify the board. Now that the survey is complete, the next step is to create a small work group to review the information. So I have a request for a motion on the board member composition committee.
Does Carlene also move to approve?
Okay. And do I have a second?
Second.
All right, thank you, Dr. Tucky. Are there any questions at this time before we go to a formal vote? I'm going to give you just a moment. Think, do you have any questions on this? Hearing none, I will go ahead and call for a vote. All those in favor say aye.
Aye. Aye.
Opposed would be nay. Any abstentions? And the absentees are in the minutes. So at this time, motion carried and approved. Thank you, everyone. Now the real work begins. I think we're looking for a 22-year-old male IT person. I don't know what worked for a legal firm, maybe. So I got it.
Specific, Molly, very specific.
Hey, then he's going to fill in some of those lower. Yeah, just saying. I have no say in it, really. All right. Does that bring your subject to a close, John?
Yep.
Okay. And we have the NCACH branding update with Morgan at this time. I thought this was exciting, so
I'm
just
excited
hush.
too. Yeah, so I just kind of wanted to give a quick refresher of why we kind of started this process. And initially it sparked from our redesign of our website. And as we were going through and kind of deciding, you know, what we wanted our brand to look like, we talked about potentially doing a full rebrand to include a new name and a new logo to go with our new website. So when we were discussing some of our goals for working with the local consultant that we chose, we noticed that with our name, it just felt like it didn't flow very nicely in conversation sometimes. Some of the partners that we have been working with for a really long time, you know, would stumble as they were trying to introduce our organization. And so we thought about, you know, if we're going to do this whole rebrand, we should look at a new name potentially as well. And then we also wanted a logo that was just a little bit more updated with kind of more of a modern look and feel for it. The current logo also presents some difficulties just from a design aspect because it includes such a large color profile that trying to incorporate that into some elements of the website was difficult. So we thought we would just kind of start on this process of, you know, seeing if we wanted to do this total rebrand. So our goals, yeah, moving forward was just including that name that maybe encompassed a little bit more of what we do, the new logo, and then a website that is user-friendly, incorporates lots of great resources for our partners, and then just really keeping our brand consistent. So that led us to the initial renaming exercise. And with the staff, we kind of went through and pulled out some keywords and some ideas as we were looking at a potential new name. And we really were gravitating towards the words thrive and thriving throughout the process. We felt like, especially with a lot of the language that we were using in the partner agreement and with the vital conditions, that it just kind of encompasses a much wider range of, you know, the projects that we support under health and wellness. And so those were two words that we were really gravitating towards. And then we also felt that the regional identity was important to keep, and that we're really focusing on the fact that we're working with all 4 counties across the region. And then we also kept coming back to this idea that, you know, really all of this great work being done by our network of partners should really kind of come through in the name and the design that we decide to move forward with. So those were some initial ideas that we had during our first couple of brainstorming sessions. And then from that, we developed a list of names that we thought kind of encompassed all of those different key aspects, which led us to what you all saw in the board survey. And so we asked you to take a look at these names that we had kind of decided on would be a good start and see what you all thought of these 3 name options. So what was really exciting about this was when we asked the staff and the board to kind of vote on what their favorite name was, you can see that the votes are pretty much identical. So that was really exciting to know that of the options we provided, staff and board really gravitated towards the Thriving Together North Central Washington. So from there, we took that to our consultants and we said, you know, we have this name, we want to work on a new logo based on this name and kind of like a new color profile. And so they ended up giving us 3 options to start with. And when I took this to a staff meeting, I gave staff the 3 different options and I just kind of asked for their initial reaction of what they liked or what they gravitated towards most. And this is option 1 that everyone unanimously was really excited about and just really liked and picked as their first choice. So you can see in the bottom, there's some symbolism that I'll kind of go through with this logo. One being the leaves and sunshine. So that's kind of incorporating the words thrive and thriving. And then we have the leaves representing the fact that our region is so diverse. So the vegetation, mountains, water, that kind of natural elements aspect to our region. And then they did a nod to the 4 counties that we work and represent with the 4 different colors in that color palette. So this was, again, initially what we all gravitated towards just internally with staff. So before I kind of move forward, I'd like to just open it up for any questions on the process of how we got here, or any comments about the name, the logo, anything of that nature.
Definitely good healing colors.
I guess I will say, just based on the comment about the color palette as well, that we did take a look at other organizations that do similar work to us, or you know, we looked at the other accountable communities of health and their logos and colors, and so we noticed, you know, being in the Pacific Northwest, that a lot of people gravitate toward the green and blue. So we did ask them to put together a color palette that represented that, but also was a little bit different. So glad you like the colors. Anything else? Any questions on the process, or yeah, any comments on name or logo?
Probably no acronyms. I was thinking of acronyms. Are we TT, NCW now, or?
Yeah, we're still trying to decide on that. I know for sure we can shorten it to Thriving Together NCW. So that would be ideally the legal name. So, and then of course in the logo design here, it's spelled out, but we can definitely shorten it that way. And we're also, you know, looking into, you know, could potentially be shortened even just to Thriving Together, to our partners who know us really well. So yeah, we have different options for shortening that.
I like that. Thanks.
Yeah.
Is there anyone who has any concerns against the logo or the name?
John, I think I mentioned it in the survey. It seems pretty general. You know, I like things that kind of tell you what it's doing in the process. I mean, not that NCACH, it took me 5 years to figure that one out. But you know, it's I don't know. Health or well-being, or I don't know. I have a hard time missing that part. Because there's a lot of thriving things. I looked up thriving and so many things came up. Anyway, that's just my only, I like what this looks like. But I would have to wonder, who is this and what are they doing?
I don't know if John, you want to jump in at all, but we did kind of take a look at the word specifically health, and all of the other accountable communities of health, even going through the rebrand, have incorporated that word. And we kind of kept coming back to this idea that, at least from our perspective, sometimes the word health to a lot of people really has more of a reflection to like the clinical aspect of health. And so something that we gravitated to with Thriving was just the fact that it really does encompass so much more in the health and well-being space. So that was definitely something that we thought about, and we liked that we were kind of doing something a little bit different. Definitely understand, you know, the idea of wanting it to be descriptive. But I think that'll just kind of come as we begin to roll out our new brand and reinforcing who we are and what we want our community to view us as in this space. So John, I don't know if you had any other.
No, you covered it perfectly, Carlene. We went through the word health a number of times, and so we didn't miss that as a potential either. But really, Thriving Together was it hit the two things that we were looking at: our vision and the collaboration piece, in keeping it simple, and that's where we ended up landing on that every time.
John, what is the time frame on rolling something like this out?
Yeah, I can jump in and kind of help cover that. So if there are no, major concerns, and we're kind of looking forward to move, we're looking to move forward with our logo and our name change. The last couple steps for us is finalizing that website content that we've already been working on, making sure that the website and the design of it incorporates the new brand direction. And then during that process, I would be working to switch over to help change our email addresses, social media accounts, all of those kind of key components, so that when we do roll out the brand, which would hopefully be at the end of the month here, everything is cohesive, and it's just kind of, we do everything at once to avoid the confusion of updating the website and then changing things over slowly. So we'd be working here in the next 3 to 4 weeks to get that all ready, and then we would do the rollout hopefully in early March.
Morgan, Peter has his hand up. I don't know.
Oh, okay. Yeah, go ahead, Peter.
I find the word that I'm missing is communities. I feel a loss of that word. In fact, thriving communities or something like that might be a little more descriptive. And if you had thriving local communities, you've got a great acronym, But anyway, that's the one word that I miss for what it's worth. Yeah.
Sure. Yeah, and that was one of our name options as well, that we incorporated that word community in the thriving communities of North Central Washington. And that was definitely a close second for us. We just basically, when we were looking at the results from the voting component from staff and board, just, kind of went with the fact that unanimously the votes were, with the thriving together. But yeah, that was definitely a close second of ours.
Great work.
Hey, Morgan.
Yeah.
Why was the choice thriving versus thrive?
Oh, yes. So there is another organization in Chelan. I believe their name is Thrive Chelan Valley. And so the local consultant that we are working with, they're based out of Lake Chelan, and they actually did the rebrand for Thrive Chelan Valley. So they really kind of wanted to steer us towards using the word thriving if it was something that we wanted to go with, because the word, if we did like Thrive North Central Washington, it would just be really, really close to this other organization's name. So they wanted us to be able to kind of differentiate in the name in that sense. And then we did kind of talk through the logo concept and the color palette, and just our name being similar to this other organization. And going through the renaming process, it's difficult to find any sort of variation of a name that is completely unique. And so we did talk with the consultants about the name being similar, and they're confident that with the variation and the fact that the space that we work in is different from Thrive Chelan Valley, that they weren't worried about the confusion with being similar to that other brand. So that was something that was part of the process when we were, looking at renaming, and ultimately just decided to go with the word thriving for a couple of those reasons.
Peter, I see you unmuted. Did you have another question?
Oh, no, I didn't take my hand down, I think. Well, no questions.
So I'm going to throw a little bit of a twist in here, because I realized this as an aha moment afterwards, and I've been messaging with Sarah Krowski. And to legally change our name, we would need a formal board motion to make that adjustment. And so, Sarah, can you explain what would we have to motion specifically for the IRS documents?
It's mostly you're registering that it's okay to have a DBA, doing business as tied to your EIN, your employer identification number. And this allows, sorry, I'm trying to turn my camera on, CLA to get all those updated with all the tax filing paperwork, and with the Department of Revenue and all those good, fun, amazing things. And so this would just by having a board motion, it's attached to support the paperwork that we run through.
But officially, Sarah, that's not changing the name. The legal name would still be the ACH, correct?
Correct. The doing business as is to add it to your IRS identifier.
Is it, can I ask Sarah, and I'm sorry, and I apologize to the board because this literally popped in as a miss of mine while we were going through this. Is there a difference between just changing the legal name and doing a DBA? And is it more beneficial to change the legal name?
That takes a lot of time. I think it would be wiser to do a DBA. And then if you really are hard up, that buys us time. So you can continue rebranding and then basically form a whole new company under the name.
Perfect.
So.
And John, for us, I know for Carlton Complex, long-term recovery, we changed it to Okanagan County just as the public image, but we did the same thing. It's a DBA. And let me tell you, it would have been torture to have changed it. It would have, you lose all of your all your credit history, all your everything you do.
Well, all you have to do is say that and I'm convinced.
So this is Nancy. I will also say that it's really important to do because I was part of a group that we just closed the doors on and that piece never got taken care of.
Big deal.
So it was something we were taking care of in the last weeks of trying to close the budget and everything out. So it's important to do it.
So do I have a motion to formally change the name?
I would make a motion to change the name, the outside name as a do business as of Thriving Together with North Central Washington, while maintaining the same base legal name.
Morgan, can I clarify, is it NCW or spelled out North Central Washington?
You're on mute, Morgan.
Thank you. Thanks, Teresa. Yeah, so we would be looking to change the name legally to Thriving Together NCW. And then we can still use the longer version in the logo, but then that way in the legal name, it's shortened.
And if we're just doing a DBA, we could actually put both. That way, if checks get written one way or the other, it works.
Thanks, Sarah.
All right, so I do have a motion.
I'll second.
One more clarification. So should the motion say both?
What was that?
So should the motion say both?
Oh, both names.
Yeah.
Sarah, can you advise on the accounting side?
A friendly amendment of North Central Washington or NCW.
Okay.
Okay, perfect.
And or.
Any other questions? I have a motion and a second.
Does your second do a friendly amendment, Molly?
Yeah, I'll friendly amend that.
Thank you. Thank you. Okay, perfect. All right. I call for a vote now. All those in favor say aye.
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 Opposed would be nay. Any abstentions? And hearing none, with our absentee votes counted as absent, motion carried. New name, new t-shirts, coffee cups.
Thank you all, and apologize for asking you to do the motion without giving you a heads up.
Yeah, no, we got to get it right. Yeah. And then now with the meeting every 2 months, that would be such a, just dragging it out so far. So thank you, everyone. All right. Now, Mariah.
Thank you, Molly. As Morgan pulls up the slides, as was mentioned during our strategic goals update, we've partnered with the Nonprofit Practices Institute to offer some training and capacity building to our collective network of partners. And I actually we're joined today by our NPI partners. So I think I see both Beth and Christine here, and I'm going to allow them to introduce themselves. Beth, would you like to start?
Sure. Hi, everybody. Beth Stipe. I'm the Executive Director of the Community Foundation of North Central Washington, and we are thrilled to have Thriving Together NCW as a new and exciting partner in this capacity building work that we have been undertaking for the last 10 years. And it is such a great collective, and it's just been really exciting. So thank you all.
Thank you, Beth. Christine.
Yes. How exciting to be part of this group. I didn't realize you had this large of a board. Well, I am Christine Morgan. I'm with Icicle Fund, have been executive director there for almost 8 years now. And the partnership we have with Community Foundation, and we call our partnership Nonprofit Practices Institute, was put in place by Beth and my predecessor. And I just love how we have been able to continually develop it together, and having one more partner in, another set of eyes and ears and good minds is just making it even better. I think it's one of the most important things we can do to use our resources well for our communities. So thank you for having us here.
Thank you. Thank you both for being here. We actually, I know that some of this partnership started after Beth and Christine joined John in the Learning to People Better Together series, and we decided we wanted to continue to collaborate and work together. So last summer, we actually sent out a survey to our partners, and this was our collective network of partners. So it went out on our email blasts, emails, targeted emailing, and we actually received 78 responses to that survey. And then we've met since to plan and, kind of narrow in on those survey results in order to see what kind of offerings we would like to give our partners. So we have built out a shared calendar. And if any of you looked at the link earlier that Caroline shared to that Miro board, we're doing something very similar with our calendar and using the Miro technology to ensure that we're all on the same page. We don't have any overlapping trainings and events with other happenings in the community. So we have a coordinated communication plan that involves both our communications manager, Morgan, and the communications folks at NPI. So it's really exciting, and we actually have some regular check-ins to ensure we're all staying connected and collaborating, truly partnering with this work. So this slide, and these slides are fairly busy. They have lots of colors and graphics, so bear with me on that. This is actually something that we're offering this week. So this Thursday, this workshop is going to be a two-part on consecutive Thursdays. So starting this Thursday, and this came out of some of the feedback from the survey about, we asked some questions about just positive workplace, a high functioning, healthy workplace, work environment, and like decision making and all of that. And so we actually worked with Nash Consulting last fall for a staff training, and we absolutely loved it. So we're really excited to offer this training, and we sold out the first workshop so quickly. There's 30 spots in the training. And so we actually were able to open up a concurrent session. So 2 different consultants are offering this training on the same day. And we have 60 spots available between the 2 sessions. And we have folks from all across the region signed up for this. And one whole team is going to be doing it together. And I think, Beth, your team is going to be joining. And I know some folks from our team are as well.
We're really excited about this one. And, it's been, like I said, the partnership of this capacity building work has been great not only for the collective community, but for our individual organizations. So we're super excited that you all took this one on, and we're happy to be participants as well.
Thank you. And then I've shared a few more. So this is one we're offering, like I mentioned, this week. The next slide will have some upcoming offerings. So I will actually, I'm not gonna go in too in depth on this although I actually do wanna share out some of the important links to anyone interested. So we are really excited about the Dare to Lead. And that is something that came from, some of the results on our survey about leadership. And we actually asked if anyone would be interested. We called out Dare to Lead. Caroline on our team had joined a training and thought it was one of the best trainings she'd ever been a part of. And so we wanted to look into that for our region as well. And so as you can see, Lizzie Perez is going to come, and we have, I just shared the link to the Eventbrite if anyone would like to sign up, and the just overall the more information on Dare to Lead, the work of Brene Brown and our facilitator, Lizzie Perez. And that will be 2 in-person sessions. So that starts in April and it will conclude in September. And in between the April and September session, there will be 4 virtual sessions in between. So I wanted to let Christine and Beth talk a little bit about the nonprofit board certificate that we currently have available. Or I can mention, I can talk about that as well. I do have some information for the chat on that one too. So if you want to share anything on that, I can keep rambling. I just want to let you talk as well.
Well, thank you. I guess all I want to say is we used to have a in-person training where an outside consultant will come and work with board members on this training. And what we're able to do with this that is so fabulous is this is unlimited. How many people can actually engage with this? So and take it over a 3-month period, maybe 6 months, or maybe for more than a year. Mariah, you might have the information on that, but we're using technology and our partnership to leverage funding and capacity to actually provide more services together than we would have if we just done this individually as funders.
Yeah, and I would add that we're really excited about this because it does lend itself to great flexibility for that person who's maybe interested in becoming a board member. Maybe they don't know a lot about what it means to be a board member. So from that very basic standpoint, we also are excited that this can be used for boards as a collective, that it's a 2-hour training. It's 5 different modules. So it's a very easy thing for a full board to sit down during a board meeting or maybe at the beginning of a retreat and everyone go through it together. One of the things that we're excited to add on to this as we move a little further down the tracks is the ability to have a facilitator that would come and join your board, or maybe it's a cohort of people that you want to learn this work with, that we could have someone that would go out and help you walk through it, answer questions, facilitate conversations in between the modules. So it's not something that you have to do in isolation on your own. However, that's always an opportunity that if you do want to sit down on a Saturday night with a glass of wine and learn about being a board member, that's also a fabulous thing. But we want to give this work in many different ways. And so that's what's coming soon.
Yeah, and if I can add one more thing is, as we are connecting with many nonprofits across the 4-county area, board health, board strength is really a key indicator of how well an organization is doing in their service delivery to the community. So if we can help boards be strong, we're really supporting the organizations in servicing the community well. So this is a key area for us to invest in.
Absolutely. Thank you both. I've put some information in the chat. I put the link for the certificate course. I think some of our staff that is participating on other boards have signed up for this opportunity. It is open to, oh, Manuel has a question. It's available at no cost to individuals in Chelan, Douglas, Okanagan, and Grant counties. And it's a, interactive lessons, hands-on, and it's very much, you get unlimited access to the course through 2025. And I don't believe there's a limit on how many folks can access the course since it's an online. Oh, and then for Dare to Lead, the limit for Dare to Lead is 50 for that one. Manuel, sorry, I'm trying to read and answer your questions. But for the online course, that one is open to anyone. And we've already had, I'm sure, more than 80 folks now. At the time when we first, there was 80 since January 1st, and I'm sure more. I also wanted to read a quick little, some feedback from a board member that signed up for this course, just because I really think that it's shows how impactful this is. So I am a board member at the Medhow Valley Interpretive Center in TWISP. This is my first board member position, and it has been a struggle for me to understand exactly what my role is and how to gain confidence in doing a better job. Your nonprofit board certification class has been excellent. I have viewed module 1 and 2 class videos numerous times, learning more details after each viewing and spending a lot of time with the workbook. I am feeling more comfortable now about my board position and am more confident about becoming a more productive board member. Thank you. So I think that just shows that this is something that is needed and appreciated in our area. And I encourage anyone on our board to go and check that out. And then I also wanted to note that there is a, sorry, I sent that not to everyone, but there is going to be on this similar note, a Powerhouse Board in-person offering. So save the date for May 18th. There's more details to come, but just kind of on this thread of building Powerhouse boards. And next slide, please. And this is something that we're really excited to partner with NPI on. And since I've rambled quite a bit, I want to really give time to both Christine and Beth for this. This is something that they've offered in the past, and we are really happy to both provide additional funding for this opportunity and 2 of our staff that will be participating in the application review process. So Christine and Beth, do you want to share a little bit about this?
Yeah, I can go first, Beth, and then I'm sure you have more to add. Last year was the first time we actually did an actual grant program together. The partnership through NPI has been all focused on capacity building, but last year we decided to try something new, and it was extremely powerful to be able to support organizations in the kind of work that they often will not apply for grants for. It's the strategic development of the organization. Oftentimes they'll submit an application for the shiny project that we all would love to fund. But even if the organization really need development at the strategic level, whether it's strategic planning or development, or other strategic level work. So we piloted it last year with 14 organizations. And then this year, we're able to give out 13 grants. And we refined the model some by including a workshop at the front end to help organizations understand what does it actually mean to work with a consultant. Because that's what this grant is. It is providing them funding specifically to work with a consultant to work on strategic development of their organization. I will say this year, we're just going through our community grants program, which for iSchool Fund is an annual cycle. And I have about 10 reviewers that look at the proposals. And because they all loved the outcomes of last year's strategic consulting program, they're now saying this organization could really benefit from, and this organization would really, this is where we can really support them in other ways than maybe our regular grant programs. And so I think it has been transformative for many of the organizations that have participated in this. I'm really proud that we can continue it, and I love that your organization is now part of the partnership as well.
I really don't have anything to add to that wonderful report that Christine gave, other than just to say that Christine has been really active in this particular program offering from NPI, and really done a great job in amending what we learned from the pilot year to give much more flexibility to the boards to, you know, if something isn't going well with the consultant, how do you go back to someone and adjust and make changes? And that's absolutely commonplace in many ways that we do business, but sometimes nonprofits don't feel like that they have that same level of authority to be able to go back to a consultant. So that's been some of the work that she's done, and we're super excited with this next round.
Thank you both. I think that is my final slide, but I wanted to note a few more capacity building updates. One other training that we actually are looking at offering, that motivational interviewing continues to come up as a need, and it's something that so clinical partners and really a lot of folks are really interested in motivational interviewing. So we actually have a training that will be at the CTC on March 16th and 17th. And when I opened the training, I sent it to the respondents of our survey that noted motivational interviewing as a high or moderate value to them. And just from that one targeted email and another targeted email to folks that had asked, we sold out in like less than 5 days. We had 24 spots, and I sold out, but it's free. So 24 spots that went that quickly. We're working with a local partner, Tori Gilden. She used to be at Children's Home Society, and she now has her own private practice and is also on the faculty at a university online. And she's fantastic. I went through the motivational interviewing trainer course with her, and I'm just so excited that we get to support a local trainer as well. So we are going to, because the need is so high and so great, and the wait list already had 8 folks on it, we're also offering another motivational interviewing workshop in the fall. So we're looking at dates in October for that, for another 24 participants. And then we're also, Joey and I are planning out a recovery coach motivational interviewing that is set, we're thinking, for April. And we're looking for doing both one here for Wenatchee, for Chelan Douglas, and then looking at Okanagan County and Grant County and seeing if we need to offer an additional training opportunities there based on the need. So be on the lookout for additional opportunities. I kind of wanted to just mention the ones for this quarter. And lastly, we will be having a report out from Oscar, the executive director for the NCW Equity Alliance, at an upcoming board meeting. There will be another partner spotlight for those as we are partnering on the learning sessions that NCW Equity Alliance is. We're providing funding and partnership as well. So that's a whole nother capacity building learning opportunity update that you'll have at a future meeting. And I think that is all. I think I shared all of my links. I'm going to put the Dare to Lead and the nonprofit board certificate course links in the chat again for those that didn't have a chance to grab them. And Christine and Beth, if you have any final thoughts for our board.
I would just say I really appreciate working with your staff, getting to know you. You're inspiring, you have good ideas, you try new things. It's lovely. And the iSchool Fund board just at its fall retreat decided to really prioritize partnerships in a new way. So I look forward to us to develop that more. And now that I hired a program officer, it's no longer iSchool Fund staff of 1. It's going to be iSchool Fund staff of 2.5. And that means that I can engage more with you in new ways. And I'm very excited about that. Thank you, board members.
Thank you, Christine.
Thank you. Yeah.
I would echo that and say thank you so much. It's been great to see this work develop over the last decade, and with Christine coming on, and definitely with your wonderful staff and your broad commitment to this region. It's been really awesome to learn from you so quickly and to get a chance to do this work in a greater way. So thank you.
Yeah, and for board members, again, a shout out to Christine and Beth, because building this partnership really got us to really engage more with philanthropic partners. Sorry, that is a hard word for me to say. And really look at different ways we can engage community. It's also expanded who else in the community we can partner with and the connections we have with that. So even the connections with the Icicle Fund and the Community Foundation has allowed us to make additional connections with partners in the community. So it's just been amazing to see this work expand and explode.
Thank you. Thank you very much, everyone. And as you know, this is our first meeting that's every 2 months. So we do set aside time till 4 o'clock for these meetings. We've kind of gone through the agenda, and now we're up to the roundtable. Open it up for anyone who has anything to say. Thank you, Christine.
Bye.
Bye-bye.
Yeah, this
roundtable. Yeah.
Hi, Molly. And I just wanted to say I already I went ahead and did that board certificate course. I did it all in a sit down all night long, or one of those neurotic moments, and did the whole thing. So it really is doesn't take that long. And even though I've had a lot of board experience, it was very concise, and I'm getting ready to present and do that in Colorado with some boards, and it really was helpful to solidify and just kind of break it down to key points, and just well done. So it's worth looking through and doing.
Thank you, Carlene. I'm so glad to hear that. It's really helpful to hear good feedback like that. So thank you.
Any other roundtable discussion?
Molly, I'm sorry.
Yes. Carlene. Yeah.
Sorry, one more thing.
Okay.
I mentioned to some folks about Tommy Miller and yourself about Tommy Miller. He's a lawyer and a tribal member.
Tribal.
Hitting all those demographics.
Yeah.
I just talked to him on the phone. He is taking 2 years sabbatical, traveling the world. He's in his 20s. And so he said he's not available, but he's in Costa Rica right now. And that's what generation is that? Millennials is
male, tribal member, legal.
Do something.
Yeah, so 2 years. We have him in 2 years. Write that name down.
That's 3-year planning for Carlene.
Nice, good job. That's the kind of strategic planning we need from our board members. Any other updates from anyone? I just do want to say that in our office here, we were sort of on a 1-year rental plan, and it was just extended. So now we're finally getting our wheelchair accessible bathroom. Yay! Because we've had to have signage that says no bathrooms available for the public. So just small baby steps to my getting this project up and going. So yeah, anyone can go to the bathroom here now, and that'll help next time we have a housing fair or a health fair. Yeah, because everybody had to use Santa cans last time. I'm sure. Is there any other announcements? Also to our public, our partners, anything that they want to bring up at this time? Hearing none. I'm going to go ahead and give us a little bit of time. These meetings will expand as we have more projects and we're more accustomed to the every other month board meeting. So I will go ahead and adjourn the meeting then with no other comments. Thank you, everyone.